You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Troy Wells is the CEO of Baptist Health, the largest Arkansas-based healthcare system, and the healthcare landscape is rapidly changing with the new Trump administration and the state legislature in session. Troy Wells joins me. Thank you for being here.
Thanks for having me, Roby.
Good to see you again.
You too.
I'm going to start with something that I think you and every other healthcare provider in the state of Arkansas is going to be excited about, and that is we've got the maternal health care package kind of launched late last week on Thursday. Kind of what's your reaction to that, and what parts of what you heard do you think will have the best impact for you and for moms?
Yeah, my first reaction is it's desperately needed. We need more attention on this issue, maternal health care, moms and babies. And, you know, the state's got a lot of options when they have a little extra money here and there, and the reality is it takes money to solve some of these problems. And so for the state and the governor to get behind this and be willing to put some funding behind the work that needs to be done to improve maternal care says a lot. And so I think the healthcare provider community should be really pleased with what we've heard so far, even though we haven't read the legislation yet.
Yeah, $45 million is the investment. Right. I did ask specifically because there is an increase in reimbursement rates for those procedures, a regular delivery and a C-section through Medicaid, which is like half of the births in the state of Arkansas. It's a lot. It seems low to me. It's like $2,900 is what it's going to come up to for like a C-section. I mean, how much is that going to help? I mean,
I haven't seen how they're going to adjust the payment, and so you know more than I do about what the anticipated rate is. But if you're so low already, anything can help. So hopefully this will be beneficial.
You'll take what you can get.
That's right.
So,
yeah.
Let's talk a little bit larger about what's happening in healthcare financing, because these reimbursement rates, not just for a procedure like that, but across the board, they haven't been raised in decades. A lot of healthcare executives that I talk to say we've got to find a way to raise Medicaid and Medicare reimbursement rates. Explain that process to me and just kind of how you've navigated and coped with it as the CEO of Baptist Health.
Yeah, the challenge really gets back to Medicare and how long that payment system's been in place. And so we're the lowest paid Medicare state in the country. And to change that, it's a budget neutral thing in Washington, so you'd have to have legislation passed to change the formula. And so with the formula the way it is today, we're kind of stuck, and it's very difficult to get enough support in the House to make a change because it's different across the country. Medicaid, as you know, we've not had a lot of raises in Medicaid over the last few decades, and so I think there's discussions going on right now as to strategies as to how we could do that without burdening the state budgets by bringing more Medicaid dollars, maybe through an increased provider tax and things like that.
Yeah. Well, I guess why does it how does Arkansas get 50th in those rates right there? What's it kind of tied to, the funding formula, I guess, that keeps Arkansas from elevating higher than, say, a Mississippi or, even a Texas or something?
Yeah, so it's a three-legged stool: Medicare, which talked about, Medicaid, and then there's commercial rates. And a lot of times, historically, the commercial payers have based their rates off of Medicare. So if you're the lowest Medicare state, the commercial payers will use that as a basis to adjust commercial rates. And so that's the history as to how we got to where we are.
I gotcha. When you look at other challenges that you're facing there, you got inflation, you got technology costs. I think COVID is in the rearview mirror in terms of how it impacted you financially, which was tumultuous. But what are you looking at on the horizon in terms of challenges to how your health system and other folks that are your peers are going to navigate this?
One of the real challenges we have today is that we've had all these bolt-ons over the years out of Washington as to how they pay providers. And so now you have a new administration, and there's a lot of talk of things that are going to be taken away that have been added on over the years. And so it's way too complicated, but at the same time, we rely on that funding today. So there's a lot of concerns about what may just be talk versus what may happen out of Washington related to Medicare and these add-on funding measures. So we've got to be prepared for those things and do the analysis and understand how that could impact our health system. The other challenges we still see are on the inputs. So pharmacy, drug costs, for example, that's not just a consumer retail cost increase, but the drugs that we use to treat patients have gone up tremendously over the last few years, and we don't see that coming down anytime soon. So between labor costs that are elevated, inputs like drugs and supplies, we're facing a very difficult operating environment, not just here in Arkansas, but across the country. It's particularly bad here because the revenue point you made earlier about rates.
When you look at other healthcare debates that are going on up at the state capitol right now, there is a lot of legislation. I know you've got somebody that monitors that for you. They might speak more eloquently than you will on that, but I think you're knowledgeable about what's being discussed and debated up there. Is there anything else you see up there at the Arkansas State Capitol that you feel like is a priority that would be a benefit to you guys?
I don't know where the discussion stands in terms of managed Medicaid. I know we're going to have a Medicaid discussion at some point during the session or maybe after the session. But that'll be the biggest thing, is how we deal with Medicaid program going forward. We have to have a new waiver soon, and so how we do that's going to be really important.
A managed Medicaid would be different than fee-for-service.
It would.
Yeah.
Correct.
Which do you prefer?
It depends. Devil's in the details, right? I mean, done right, I think managed Medicaid has served some states well. Done the wrong way, it could be a disaster.
Yeah. Let's talk about something a little bit more specific here. I think I've read a report that that 62% of the announced hospital transactions in 2024 involved a divestiture of some part right there. Rumors that Baptist Health may be in some talks to divest. You've seen other hospital systems do some creative and innovative things. You guys have done some things in partnership with UAMS. Can you comment on kind of where things are in that landscape?
Sure, yeah, and I read that report, and it's no surprise that people are trying to adjust their portfolios given the operating environment that we're in. And you know, I hear rumors too. People bring those to me, and specifically Fort Smith has been the most recent one that I've heard that people are talking about. And you know, I understand. I get it. They've had 4 ownership changes in 15 years. Very difficult operating environment. I talked to my colleagues around the state. Hospitals are struggling, having a really difficult time. In difficult times, you make difficult decisions, and sometimes those decisions are not real popular. And I think a lot of times those rumors manifest from those types of moves that you make to try and stabilize your operation. But it is a tough operating environment. I think it comes from that. The fact is, we have not talked to anybody about any divestitures. And last year, the only conversations we've had in this merger and acquisition space has been about adding hospitals to Baptist Health. And there are a lot of hospitals out there that need help.
You got people coming to you saying, will you buy us?
Yes.
Really? Mm-hmm. All right. But the answer's no right now.
The answer's no.
All right.
Yeah.
All right. Well, lastly, let me just ask you this question right here. Just when you look at your system, system-wide right here, do you see potential to go to other areas of the state? What's happening in the southern part of the state? There seems to be some more stability down there in terms of some investment from state of Arkansas as well. Where do you see some other opportunity there?
Well, you know, we acquired Drew Memorial last year, and so that's been about 1 year since they've been part of our system. So we're having more conversations in southeast Arkansas, how we can stabilize that part of the state in terms of healthcare resources. All the hospitals are having a difficult time. How can we work together and make that better? Southwest Arkansas is another part of the state that could probably use some help, and we've had conversations with hospitals in that part of the state as well.
All right. He's Troy Wells. He is the CEO of Baptist Health. Always good to catch up with you. I appreciate you being candid with us on a lot of things there and sharing with us what you got going on. So let's stay in touch.
Happy to do that. Thanks.
All right.